Hi, a very good evening to all of you. Today we are going to discuss the case note of Mr. HARLEY CHAPMAN, uh, an 82-year-old patient who has undergone amputation, below the knee amputation for the complications of diabetic neuropathy. Now, let us discuss the task which we have here. Using the information given in the case note, write a transfer letter to the receiving nurse at the skilled nursing facility. So you are going to write a letter of transfer. So you are going to transfer this client to a skilled care facility. And a nurse is going to receive the patient at the facility. And the facility name is Broom Grove Nursing and Convalescent Home. And it's in Sheffield. So what is the purpose of writing to this particular care? That is skilled nursing care facility. The purpose of writing to this skilled nursing facility is for acute care and physiotherapy. So you are writing to a receiving nurse at the skilled nursing facility, requesting him or her for acute care and physiotherapy for Mr. Chapman. And that's very clear right now. Now let us discuss the case in detail. Now we have Mr. HARLEY CHAPMAN, 82-year-old, as per 2018. So you have his wife as Barbara Chapman. Mrs. Chapman is just 5 to 6 years younger to Mr. Chapman. And we have the admission date on 8 and discharge on 28. So we have around 20 days stay at the hospital. That is Barnsley Hospital at South Yorkshire. So you have treated as after the below knee amputation, you as a registered nurse has been treating Mr. Chapman at the medical surgical unit of Barnsley Hospital. Now, what about Mr. Chapman? Mr. Chapman is a retired postal worker. So he's a postal worker. He's a retired postal worker. And right now he has wife and she's also aged. And for the family, for the past 6 months, he limited his social interaction outside the family. And he started the necessity of assistance for carrying out his daily activities. And this is his reason. He became unable to perform his daily activities independently. So this is what we can see as the social background here. Now, pertaining to his medical history, if you can see that this patient has diabetes mellitus type 2 since 2003, Now it is 2018. So it's a long history of diabetes. Now we had hypertension, osteoarthritis, dementia, cognitive impairment, a lot of problems, which is especially seen with the old age people. So geriatric problems usually, but you have some specific things here. So it's all when you give care to the client, especially acute care, you need to be aware that Mr. Chapman is hypertensive, Mr. Chapman has osteoarthritis, because if you are giving physiotherapy, you may have to be, you have to take care. Utmost care should be given to when you give physiotherapy right now, because he has osteoarthritis. And you know that dementia, if you have something, if you want to want something to remind him, it's impossible, because you know that this patient has age related dementia here, and you have all these things you have to take care, because you need to give, if you are transferring the client to another nursing facility, that nurse should be aware that this person is hypertensive, his person is having some age-related dementia, osteoarthritis, all these things. It's quite natural, so we need to include this past medical history in the case note in the letter which we are going to write. And right now the present history is diabetic neuropathy, and after that we have the right diabetic foot wound with pus, abscess, fever, chills, and gram-positive bacterial cocaine. Now, what we have seen here, what we have seen here up right now here, when he came, he had these many problems. What we gave, we started antibiotics, and we sought the opinion of the vascular surgeon, and he recommended, or she recommended, below knee amputation, and which was successfully performed without any complication. Now he had uh, medicines going on. After that he responded to medicines. So you can see the progress. Wound is clean, dry, intact, but still requires assistance in daily living. Now, as a nursing management, we have certain things to take care. That's dressing change, monitoring for surgical site for any changes of color or infection. Now we have to enhance the wound healing by giving him more fluids and nutritious food. And we need to give importance to the mobility of the patient. We need to prevent problems such as bed sores. If you have good mobility, you don't have this decubitus ulcers. Because when you are lying on the bed supine all the time, you may have the problems of the risk of decubitus ulcer. So we need to avoid such situation. This is another nursing management which we have to focus on. Now, as we are assessing the patient before the transfer, when we assess, we can see the patient has good progress and the pain has managed well, no signs of infection, blood cultures negative, but you have reduced mobility and requires assistance for performing activities of daily living. And this is what we can see here. Now, what we have to write as a discharge plan, we have to inform the receiving nurse that you have to give acute care. That is, acute care includes the nursing management which you were giving at the hospital. So this is acute care actually. And physiotherapy is mobility. It's because you have physiotherapy and occupational therapy after 4 weeks of from this time, that's 28 April. And that's professional help, that is professional physiotherapist and occupational therapist will be attending the patient. Till that time, you have to mobilize the patient. That's the meaning of this physiotherapy. And you can say the medication compliance, and um, you have a follow-up after 2 weeks. So these are the things that we have to take care of there. Now let's go with the letter 28, that's today's date. The receiving nurse, yes, here, skilled care facility. So I can mark this, sorry, skilled care facility. Broom Grove Nursing and Convalescent Home, 30 Broom Grove Road, Sheffield. Dear nurse, or dear sir, madam, reference Mr. Harley Chapman, aged 82. So don't have the date of birth, you have to adjust with the age, the present date, age. So what is the purpose of writing? I'm writing to refer Mr. Harley Chapman. So if you want to write the word introduce, you can write the word introduce, because that is more relevant here, because you know that this is a transfer letter. So I'm going to introduce. I'm writing to introduce because there's a new person. Introduce Mr. Harley Chapman, who requires acute care and physiotherapy. Yes, don't need a comma there. He is recuperating after a below knee amputation and is being transferred to your care today. So that's it. He's been transferred to your care today. He's recuperating after a below knee amputation. Now, Mr. Chapman. So we are going to introduce Mr. Chapman. Mr. Chapman is a retired postal worker. So you are transferring Mr. Chapman to this care. So he's been transferred to your care today. So who is he? He's a retired postal worker who lives with his aged wife. He has a range of health issues, including here. Okay, he has now, right now, he has the past medical history, has hypertension, age-related dementia, cognitive impairment, all these things are there. A range of health issues. We are highlighting hypertension, peripheral vascular disease, osteoarthritis, and age-related dementia. If you want to cut the peripheral vascular disease, which is not important here, you just cancel it off, because we have already said a range of health issues. So take 2 or 3. We have taken 3: hypertension, osteoarthritis, and age-related dementia, which is relevant to our care. Apart from these, he has had type 2 diabetes mellitus since 2003. So you have all these problems. Apart from all these problems, he has had type 2 diabetes since 2003. He has, so has a long history of diabetes mellitus. Now, Mr. Chapman was admitted to our care on 8 April 2018 with complications of diabetic neuropathy. So what he got admitted to our care recently is for the treatment, of diabetic neuropathy. His right foot was infected and the wound was gangrenous with abscess. So we are not going to write fever, chills, gram-positive cochlear, or we are just outlining the situation. How he came. He had diabetic neuropathy. His wound was infected. His wound was gangrenous. His wound was filled with pus or abscess. So this is what we have seen here. Now the presenting complaint. what is the condition, how he was presented. Right now, what we did as per the recommendation of vascular surgeon, he underwent a successful amputation procedure. So what type of amputation is given in the purpose paragraph? So we are not going to give BKD, BKA another time. So it is already said. So a successful amputation procedure. Now the location is given in the previous sentence, that is right foot. The wound was in the right foot, so the amputation will be there in the right foot only. So it is quite understood. Post-operatively, he was prescribed with antibiotics and pain medications, to which he responded well. So he was given antibiotics and pain medications. I have to see the, yes, IV antibiotics, oral antibiotics, opioids. Okay, so he was treated with, he was prescribed with antibiotics and pain medications. So however, his mobility has reduced substantially, and therefore he requires assistance in carry out his daily, his activities of daily living. So the purpose, the condition of Mr. Chapman is good, but right now his mobility has reduced substantially because he has lost lower limb. So, and he's aged. So already he was seeking help for carrying out his daily activities before the admission. Right now he needs more care and support there. So this is the condition. So this is the condition. So in view of the above, it would be appreciated if you could continue the ongoing nursing care, focusing on wound care, medication compliance, and mobility enhancement. So we are requesting the receiving nurse to consider continuing ongoing nursing care, focusing on wound care, medication compliance, and mobility enhancement. And this is what we are going to, this is why we are going to write to the receiving nurse in the skilled nursing care facility. Although he has good progress, yes, he has good progress, he still needs nutritional support and constant monitoring for any signs of infection. So that's what we have written the second here. He has good progress, but he needs nutritional support. He needs oral fluids and all nutrition to enhance his wound healing. He needs all these things. And if there is any signs of infection, you need to inform immediately. And we have two more things there. That is the follow-up care of the vascular surgeon who has performed the surgery, and the initiation of the physiotherapy and occupational therapy within a month. So this is what we have included in the letter. Concisely, briefly, we have given an outline of the condition of Mr. Chapman, the requirements of Mr. Chapman till he starts his physiotherapy and occupational therapy after a month. And that is the explanation of this particular letter. Thank you.